Immunogens and antigens. So far, I've been talking about antigen, and I gave you a rough definition that anything that wants to invade you, want to enter, we call an antigen, right? But I'm going to introduce another term today, immunogen. But before I do that, let me give you some of the objectives. I'm going to talk about immune response. What are the requirements of immunogenicity? I'm going to talk about classification of antigen properties and some of the cross-reactivity that they may have. Clinical significance, many a time patients will ask you, and they do ask us as well, can I get allergic to such and such thing? You know, can I have allergy to that kind of a food, that kind of a jewelry? And even if I do, what is it that our body is doing to protect us from that kind of allergy? So all these questions will be answered if you pay attention to today's lecture, and also give you some of the clinical implications for that. By the end of the day, whatever wants to enter you and you want your system to see. So immune system, as we discussed earlier, is a defense system. And any foreign substance, when it wants to enter the body, there will be a response. And this response is called immune response. Right. Now, the question will be that we breathe in the air, and there are many things in the air. We eat many different things. We wear many different things, jewelry, cosmetics, and we come across many things. What sets the tone and what tells our immune system when to respond and when not to respond? For example, if our immune system becomes overactive and we start responding to each and every antigen, then our situation will be that we will be walking with cancer of immune cells. There will be so many cells out there that we will be bags of cancers. We don't want to do that. On the other hand, it may occur that bacteria, viruses, fungi, and other foreign substances are coming into our body, causing infection and killing us, and our body doesn't want to respond at all. So there has to be a profound, useful, a good response. And that's what we are going to discuss, that as a normal response, as an immune response called IR. Now remember, there are two terms, or rather three. One is an antigen, what is an immunogen? So anything that is considered as a foreign, and our system has a way to identify that, is an antigen. And if our system sees that antigen and wants to respond to it, and wants to mobilize the whole immune system, we will call that immunogen. So as a rule, all immunogens are antigens, and all antigens are not immunogens. We don't expect everything foreign that we breathe, we eat, come across us, to our system to respond. So basically, there's a functional distinction. And let me tell you another third part of this story is that once we do allergy, there will be something called allergen. So allergen is more specific term when an immunogen creates an allergy. So all those immunogens that have a very specific way of initiating a hypersensitivity response that we will discuss as a part of clinical immunology will be called allergens. Now the idea is, what is it that sets the tone, how our body deals with it? And I keep on giving this example of Homeland Security and police and so forth. Because the idea is that, as we discussed yesterday, let's assume that there are 3 different ways that a person can come to the United States. He can take a plane and land on the airport, right? He can take a road and come to the road, or it can come through sea, right? So there are 3 obvious ways. So likewise, an antigen, it can come through the skin, it can come through the mucous membrane, right? And that mucous membrane will imply nasal entry, oral entry, vaginal entry, rectal entry, urethral entry, anywhere where we have an opening to our system and there is a mucous membrane. And lastly, if something is injected to us, like in blood, that again will be another portal of entry. So everywhere we have those specialized cells. And I said these are called antigen-presenting cells. And if you look at the receptors, so something that is going to receive you. So we have 2 sets of cells, and just for you to, just for a mnemonic, B and T cell, and I'm going to use a little bit of a mnemonic over here, which is like mom and dad. And let me take liberty on saying B cell as a mom and T cell as a dad, right? And these are like cops, they are policemen. So if you are there, they are the first one who are going to see. So any antigen that your body will be exposed to has to be seen by these 2, a B cell or a T cell. And these B cell and T cells have receptors, as we discussed earlier as well. They have that special machine that they're going to screen you. They have that holder. And then again, you come with a tag, a computer tag. Okay? Now, having said that, let's go one step back and figure out how our body sees that molecule. So that molecule, what are the intrinsic things that make an antigen an antigen? Right? And that's where will be answers to quite a few questions when people ask you, can I get an allergy to such and such food, a carbohydrate, lipid, or fat? Can I get allergy to coffee? Can I get allergy to Coke? Can I get allergy to banana? Or anything, any food or consumable, a nylon, nickel, anything that comes across you and touches you. There is a chance the immune system will see that. So let's decide what is it that makes antigen an antigen. Firstly, remember, this is in our interest that we should not react to everything. Correct? But having said that, there may be some people among us that would react to everything. And we'll call these people hypersensitive. These are the people, they may have traits, tendencies to become allergic. They have inherited it. This is coming from their parents. This is in their genes, so on and so forth. One of the factors. But we should not respond to anything which has low molecular weight. We should not respond to a low molecular weight compound. That's why in pharmacy, we try our best that we give you drugs or antibiotics or anything that has low molecular weight. That's an idea. Drug absorption, drug delivery. So keep that as a basic thing. Because if you mess up this principle, your body is going to react. Okay? But what may happen is that sometimes these low molecular weights, they sit on a larger compound like protein. And they become high molecular weight compounds. So in that case, there is going to be immune response. And when it happens, in this case, for example, a low molecular weight by itself is unable to provoke a response. It sits on a protein. We call that as a conjugate. Sometimes you see on vaccine, say conjugate vaccine. So that term, conjugate, is coming from that. So in this kind of a relationship, low molecular weight is called hapten. Hapten means something that you grasp onto. Hapten. I think it's a Latin word. And in this conjugate, high molecular weight, which in this case is a protein, is called a carrier. So we have a carrier plus a hapten, and then again it will change the rules, and we will have a immune response. Okay? Now, again, question for your basic understanding is that there are biochemical families of compounds that we have seen that people become allergic to or people respond to them. There is an immune response. But remember, when I say immune response, this means it's going to mobilize the whole immune system. There's something going on, where there is an activity now going to take place. Like you go on a drive on a road and you see all those kind of, walled off area and says police action, activity takes, something going on, that area is barricaded. So that happens in this case. So as a rule, as a principle of immunology, all carbohydrates, all lipids, all proteins, all nucleic acid can, doesn't mean they always do, can provoke an immune response. So likewise, drugs, antibiotics, food additives, cosmetics, they all provoke an immune response. So you can become allergic to that. And finally, small synthetic peptides should not provoke an immune response, should not cause you allergy, but remember that they can sit on a carrier and then they may cause problems. Now, these are 5 different principal requirements. Remember, I just said to you that based upon your interest in immunology, I need to set up a prerequisite, a requirement. So we have to set it up. What is it that you qualify for? So in this case, there are 5 different requirements. Number 1 thing is foreignness. Remember, the immune system is trained to differentiate between self versus non-self. So anything your immune system sees as a foreign, it will respond to it. Number 2, it has to have a high molecular weight. Number 3, it has to be chemically complex. If I ask you of all those compounds like carbohydrates, lipid, fats, nucleic acid, which one do you think will be more chemically complex compound? Louder. Which one of the things will be more chemically complex? Proteins. Proteins. You know the structures of all compounds. Lipids are simple. Carbohydrates are simple. Protein. So having said that, remember the chances are most of us will become allergic to or we have an immune response to proteins. Okay? The other important thing is that whatever that antigen is, it has to be broken up. It has to be broken up. It should have this capability to be degraded, broken up into small pieces so that it can be presented to the immune system. Because the immune system likes to see, as I said the other day, your mug shot. It's going to look at your mug shot. It's going to look at your face. Right? So you have to give the immune system identity. So it wants to see something, a larger molecule broken up into smaller pieces, like a big protein. It's not going to look at a big quaternary compound. It just wants to see the sequence of amino acids. It's just going to ask you your telephone number, the code. So the chord has to be short and small. And as we go along, I'll tell you what the reasons are. And finally, most of the time, remember when I say most of the time, because I'm teaching biology and immunology, they are biological sciences. We teach you the basics, but remember there are always exceptions to the rule. When we say, you heard Dr. Kumar talking about statistical analysis. So most of the time, 99.9%, 80%, 70%, but there always are exceptions. Keep that in mind. There's no such thing in the body is perfect. Okay? Now, we want all the antigens that are going to cause you allergy, or immunogens or allergens, they should interact with your genes, major histocompatibility complex. Because your genes need to see that. I just told you, if you are allergic to something, it's in your genes. So when you hear from your mom or dad that, when we take milk, we got this lactose intolerance. When we do this, this happened. So you have to pay attention because you inherited those genes. The chances are that you may, but not always. Does that make sense? The reason is, immunological reason is, that anything that your immune system wants to respond to has to interact with your genes. So basically, your genes are seeing it. That's why we say most of the time. Now let's talk about the very first thing, foreignness. We already talked about that. There's a system in the body that differentiates between self versus non-self. The more non-self you have, the more powerful will be the immune response. And if that system fails, you have a problem. You have autoimmunity. You have a disease. And we'll discuss that in detail afterwards, how autoimmunity causes problems. The second thing is that, as I said, it has to have a high molecular weight. So when we say low molecular weight, we're talking about 1,000 Daltons. They are not immunogenic. Penicillin, progesterone, aspirin, they usually fall less than that. And then again, you'll ask me, we do get penicillin allergies. So when you think of that, remember this conjugate. And we'll discuss that in detail. But by the nature of these drugs, they are designed in a way that they are low molecular weight, 1,000 Dalton. Then again, 1,000 to 6,000, like insulin, adrenocorticotropic, hormones and other drugs, they also should not cause a response. They are designed in a way. But if something is more than 6,000, like you have albumin, right? Albumin is in eggs. People have allergy to eggs, right? Albumin. Then if you go for tetanus toxin, they test you because you're going to have allergic reaction to that. They have this capability to provoke your immune system. And this one especially is actually actinomycin D. This is another anti-cancer drug because some of the cancer drugs are there that may provoke immune response. And then again, as a rule, the response is directly proportional to molecular weight. So higher the molecular weight, the stronger will be the response. This is basically the basic thing. The third thing is chemical complexity. That's why simple molecules seldom are immunogenic. If something is simple, right, 30 kilodalton, or maybe even high molecular weight, about 50 K, they usually, most of the time, are non-immunogenic. But as we keep on attaching things, because proteins have these things of attachment. But for example, I just told you, if there are carbohydrates, proteins, and lipids, of all these three, you should have allergy to protein more. Your immune system will respond to proteins more as compared to lipids, as compared to carbohydrates. But remember, sometimes what may happen is that there will be glycoproteins. So when you keep on attaching moieties to the compounds, this is a glyco compound, you add protein to it. Lipoproteins. So once you mix something up with It's like you're eating something and you want to put sugar in everything, right? So if you put sugar in everything, that's going to increase your toll on your sugar level. And especially proteins, because they're highly complex, they have, if you look at the structure, they have a primary structure, very complicated. If you have a secondary structure, then they have all complexity, and tertiary structures. So you can see they exist in different kind of polypeptide chains, and they are alpha and beta helices, and they are alpha and beta plated proteins, and these basically will add on to complexity. So your immune system will come, your B and T cell comes, and they'll say, wow, this is very complex. So anything that is complex, they want to know the details. But by the end of the day, they would only respond to small molecules. So what they would do is that they will disassemble this protein, break it apart, and then see things in chunks. For example, let me see. In this case, you can see this is a quaternary structure of protein. And there are 2 or more polypeptide chains over here. That's very common, especially in body. And when these proteins are there, for example, 2 polypeptides, they are assembled together, you may see a groove in between. So these kind of activities happen in protein as compared to lipids and carbohydrates because of their malleable. And remember when I taught you the gates of the cell, I said mostly they are proteins because protein have this capability of, number 1, getting phosphorylated, getting activated, deactivated, opening and closing. So they're not rigid, they are malleable because of the structure of that. Okay? So these are big molecules, alpha helices, beta plated, and this is polypeptides, but we want to break it apart, right? You are a 6-foot, 7-foot person. You know, the immune system just want to look at your face. This is a very small area to record the data. So that area that is presented to immune cell basically is called an epitope. And the antigen-presenting cells will firstly see that. And they will, it's just like you see somebody over there, you bring in some activity happening on the road, so they will kind of see something bad going on, and the cop would want you to come to the police station for detailing, for all these things that they want you to go through. That's where they will take your mugshot. They're going to take, I hope, I don't know though, they will take your mugshot on the street. They would rather take you in the police station and then do all the detailed analysis too. So exactly that's what they do. So antigen-presenting cells will take this antigen in, break it apart, and then present a very small portion of the sequence of amino acids to the mom and dad, to B and T cells. Now this process is, number 1, called antigen recognition, so you have to recognize. Number 2, it's called antigen processing, so it has to be processed. So these antigen-presenting cells have capability to take the big chunk of protein, break it apart, disassemble it, break it up into very tiny portion, and decide what is it that they want to present to B and T cell. So that small piece is called a epitope. But remember, sometimes the structures, for example, are such that they cannot be properly processed. One of the classical examples is the carbohydrates, basically. They are not processed. So if I was to ask you what is the difference between B and T cells, and as I said, I will call B as a mom and T as a dad. So in your home, if you do something wrong, the chances are your mother is going to cover it up. And she is going to kind of, take your side, right? So she will be more adaptive, more kind of in your favor. So, okay, right, So you are carbohydrate, and I'm going to process you. So T cell would say no, straight no. I'm not going to deal with you. But still, B cell will say, no worry, we will take care of you. Okay? But at the same time, what may happen is that some of the compounds may be partially degraded. And that happens especially when they are proteins. And I'll explain that to you because of the structure. Why do they do that? Now, finally, there are other things that may also add on to immunogenicity or genicity of your body. How it's going to, number one, as I said, your genotype. So genotype, we know for sure that there are some genes which are more allergic. Then again, you may have a different B and T cell repertoire. So the thing is that you say, yeah, well, you said that mom covers everything, but most of the time, but that kind of a relationship may not exist in broken homes, that may not exist in single mom, and so on and so forth. So remember, if such a thing happens, it also depends upon how your B and T cells are trained, right? So that again will determine as to what will be your response. And then again, it also depends upon the doses of antigen and the route of administration of antigen, right? If the dose is small, you may not have an immune response. So what you need to do is that you have to repeatedly administer the antigen. That's why for hepatitis, for example, there is a booster dose, right? For some of the other DDT, they give you one shot and come back, second shot, third shot. So this means now your immune system wants to take it into 3 steps. So in order for a good immune response, that's why if you miss one of the shots, they'll say, no, you have to do all over again, because your immune system, you messed up your immune system. These booster doses were to be 6 months apart or 3 months apart, because that's how the immune system deals with you. Okay? So we have to do repeated. And sometimes what may happen is that antigen is insufficient, and then again, your B and T cells don't care, because they said, that's fine, let it go. And then there are many other factors there. Now, if I was to, for example, ask you that if antigen wants to enter in your system, where would this antigen or immunogen should expect strongest resistance of all those portals of entry that an antigen has to enter you? Where would that antigen would have the highest resistance or highest processing or highest paperwork or highest whatever? Skin. Good, skin. And the reason being, well, many a time when I ask you the question, the answer is on the slide over here. So it depends upon route of administration. Subcutaneous, strongest immune response. So this means skins being the largest organ. Most of the allergic reaction of the drug you will see on the skin. The patient, the moment they consume, you will see the skin changes, the color of skin. Skin is a very, very kind of a reactive, responsive organ. You look at your skin and determine what's going on. So the reason is the skin has those antigen-presenting cells which are called skin Langerhans cell, and that is the reason when we want to test you for allergy, we want to test you for skin testing. And there are many reasons for that. If something is given to you by IV, you give an IV injection, it will go to blood, blood will be filtered in spleen, and there are antigen-presenting cells sitting in the spleen, right? And they will react to it or do not react to it. It depends upon how the system wants to deal with you. And then again, if you were to take something orally, there are antibodies. One of the things that your body generates in response to an antigen Actually, that's where the world came from. Since like 50 years ago or more, that they talked of anti-serum, and they think anti-serum are antibodies. So for antibodies, antigen. So your body sees an antigen, it makes an antibody in response. So there is an antigen-antibody complex. That basically is the basis of immune response. Okay? And that is the basis of all the immune tests, and that is the basis of the test that you will do when you come for the first lab. Okay? And then, of course, you can test intranasal, right? But many a time, if they were to test you for an allergen, they would not test you for intranasal or IV. They would rather want to test you for the skin, right? The reason being, because if they were to test you for IV thing or intranasal, they have to do it in ER or in hospital, because you may have an acute reaction. And that's dangerous. That could be life-threatening. So you may react to an antigen to such an extent that you have an asthma or you have a shock. Okay? Now, having said that, we already agreed that antigen is there. Antigen has some qualities to invade you, and then you have a response. And this response, basically, we divide that into primary and secondary immune response. And these are the terms that are important for you to understand for understanding vaccination as well. I know I did talk about vaccination, but remember, what is happening is vaccination is that they are trying to enter into a system an antigen, of course, for a good use. That's the whole idea. So when your system sees any antigen or immunogen for the first time, is a first exposure. We call that as a primary immunization. And the response to first seeing of that particular antigen will be called primary response. But if, and that of course occurs immediately, so that's an immediate. If it occurs after second exposure, it's called secondary response, and that may take weeks or years. But the difference between these two is that the primary response basically occurs immediately, and it is of less intensity as compared to a secondary response. And then again, in the primary response, your body doesn't keep the data at all times. But in the secondary response, what may happen is that it usually has a memory of the first. So you say, you know what? I took that such and such food last year and I threw up. So you remember that. Your immune cells also remember that. And once you look at it, so you will have that kind of a feeling. So immune cells will have an immediate reaction. And the reason for that kind of a memory is that that information is stored in B or T cells. Okay? Now, let's talk about the physical interaction of how the cells see that. So there's an antigen, and then there is an antigen binding sites. So of course, antigen binding site are most of the time on the cells that are going to see an antigen. So what we normally talk about is that let's take an example of a protein. So protein has polypeptides and it has a sequence of amino acid. But what your system does it, that it has antigen-presenting cells, right? And the commonest antigen-presenting cells are dendritic cells, macrophages, B cells, and some other cells. But let me give you an example for that. So what body wants to do is that it wants to cut that chain of amino acid into very small pieces. So something like, let's see, 5 to 7 amino acids, right? So in case of, for example, a T cell, if T cell wants to see an antigen, it will only see 5 to 7 amino acids, right? Because the reason is that it's just like if I want to grasp something, I have like 5 fingers over here, so there is a physical limit for me to grasp something with my hand like this. But I cannot grasp onto the big table. Right? I actually usually give that an example. I didn't see many NBA players in my life. But I did once went to, probably it was in Houston, and at that time, like many years ago, I, for some reason, came to see Hakeem Olajuwon. And the only thing I noticed was his fingers. Oh my goodness. You know, there were 3 times, so they can just put this hand on the basketball and just grasp it. You can't do it. I mean, maybe you can, I cannot. So they grasp the big basketball just by one hand, like this. So they have this capability of that. So that, the hand of the TCR basically is big enough to take a sequence of amino acids. The reason is because the binding is non-covalent binding. So it's going to be, for a purpose, you take a basketball, hold it, and throw it. Because it has to attach and detach. That's what we want. Okay? Now, let's see a figure. Maybe that may explain a little bit better if it comes in a while. So, B cell has receptors, and the T cell has a receptor. Again, I gave you example from mom and dad. So, if you look at the comparison, antigen interaction, B cell has a B cell receptor. Simple. And the T cell has T cell receptor. Now, you can see, as I said earlier, T cell, being dad, is not very accommodative. He said, well, you know, I'm just going to take meat. I like meat, proteins. So he's not vegetarian or any other. So that's the only diet he wants to take. So he said, I want proteins only. I'm going to deal with proteins only, peptides. But the B cells, they want to accommodate everything. They're more prudent, so to speak. So they say, no, who's going to take care of the rest of the stuff? Because there may be some of our enemies coming in terms of bacteria, viruses that may have proteins, polysaccharide, and lipids. So I'm okay. I'm going to deal with that. So they deal with everything. The other thing the T cell does, again, a very kind of moody, they say, you know what? If you give me something dissolved in something, I'm not going to take it. So I don't want soluble antigen. I want only antigens that are attached to something. Right? But B cell, again, said no problem. We'll take care of the soluble antigens as well. Just remember, sometimes the antigens they're attached to a cell, and sometimes they are free. Right? But T cell, lazy. Right? He said, no, I want it to be prepared, presented on a plate, only protein, make sure that my genes, I like it. So he's like, but B cells, very accommodative, very adaptive. And if you look at their epitopes, they recognize is that, as I give an example for the kids, moms are more accessible than that. So they are more accessible. Right? And they will go for anything, whether it's a sequential or non-sequential. So they're not kind of worried about the presentation and this and whatever is there, job needs to be done, I will do it. But the T cells basically are very, very particular. Only proteins, that size, it has to be linear peptide, and I will just eat the antigen if it is presented to me on a plate of gene. So it wants to see anything on genetics. You say, I'm not going to take care for anything else. Okay? Now, if this is an antigen basically, a sperm whale myoglobin. Your myoglobin is a sperm whale, but you can see your myoglobin, if you remember your red blood cell, is a protein, and then protein has different structures. You can see this is a heme component, and this is presented to you. Now, antibodies are small. Antibodies are immunoglobulin. They have small. I mean, I usually give an example. If you type a dancing girl or dancing lady on the Google, So what you will see, the very first dance will be a young girl, right, with hands raised like this. So this is like the first motion of the primary dancing technique. So that exactly is immunoglobulin. So then again, I would say, well, it's a dancing, beautiful. All these characteristics more fall to like a feminine idea as compared to male, like an antigen and the T cell. And I mean, don't take me wrong, but I don't want people come to me and complain. But the antibodies are limited. There is a limited thing. So they need to see something small. So they will come and look at these sequences. Remember, I told you 7 to 12 amino acids. So they will look it up and then react to that. And some of the compounds, for example, you can see amino acid residue. So some of the compounds are so hidden inside that the antibody would not be able to see that. So antibody, which is a response of immune response, has to see something before it attaches. If it doesn't, because of physical interaction. So it has to see that. In this case, if you have something hidden over here, they don't see it, they would not react. Right? Likewise, in this case, you can see this is a structure of your major histocompatibility class 1 molecule. So this is the mouth, for example. If I'm a T cell, okay, I'll have to say myself a T cell, not a B cell. A T cell, and I want to, I say I just need proteins. So I want to take proteins, right? So there's a big chunk of meat in front of me. But of course, I'm going to break it up to a size that can fit my mouth, right? And this mouth basically, like upper lip and lower lip, is like a major histocompatibility molecule. So it has a limitation in terms of what is it that's going to go in. And then there is a groove there. That's what I'm trying to emphasize, a groove there. And then there are complexities of proteins, but I'm just giving you an idea of the physical nature of this antigen recognition. And you'll wonder why I'm talking about that, because we have to come up with drugs. Okay? Now, these are some other possible antigenic structures that may exist on epitopes. For example, there could be only one epitope, one structure that your antibody sees on a given set of molecule, or it will be more than one. So it could be one epitope, multiple epitope with the same specificity. It's like I have a key and I've got 5 doors and it can open all 4 locks. But if the locks are different and I want to open them, so I have to carry 5 different keys. If antibody is going to attach, one set of antibody can attach over here. If the epitope is the same antibody will attach over here. But antibodies, for example, since the structure is different and it's like a actually perfect fit, it's not going to fit. You have to have, in this case, 4 different antibodies, and that happened many times in proteins. You can see the complexity. So your body will see proteins like opening up a door with different locks. It's complicated. Correct? So let me summarize what I just said. We talked about carbohydrate, and they are polysaccharides. So antibody responses occur in the absence of T cell. I just told you T cell is not interested. But if you add a glycoprotein, then again, T cell will come and help you out. Now, teichoic acid of gram-negative bacteria. So there are some structures on gram-negative bacteria that will provoke an immune response. So that particular moiety, which I'll discuss in detail when I talk about bacteria gram-negative, is teichoic acid. So you have an antibody for that. Or the blood groups that you have, which are polysaccharides. So these are polysaccharides, ABO blood group, and you have antibodies for that, and these are serious consequences. So these are some of the examples that you have. The other example in terms of lipids, I told you they are rarely immunogenic. So that's a good thing for lipid. But if they conjugate with protein, lipoprotein, they could be immunogenic. and then it forms a hapten, and we have example for glycolipid and sphingolipids. And guess where these two kind of structures are, molecules are? Where are they? Nervous system. They are there in the nervous system. Good news is that you have a nucleus in the cell, very deep. Normally, these nucleic acids, like DNA, they are poorly immunogens. We normally don't react to DNA. But again, they can conjugate. You can see the problem with conjugation to protein, when they hook up with the protein and they cause problems. So you may have immune response. But as a rule, DNA itself in its native helical structure is non-immunogenic. But having said that, one of the notorious disease, very common in this country, called systemic lupus erythematosus, SLE. The problem of SLE is that your body sees your own DNA as non-self, and it produces an anti-DNA antibody. So it's on your friendly file killing mission that cause problem. And finally, as I said earlier, all proteins are immunogenic. And mostly the common reaction that you get is because of protein, because they are very complex. We have a very vigorous immune response, and depends upon the size and complexity. And I also told you that they basically are the one that cause a reaction. So by the end of the day, as I said, the antigen antibody, they come across each other. It is a non-covalent binding, right? And this non-covalent binding between antigen and antigen, we have 4 different aspects for that, because that is the basis of the test that we'll use. These are electrostatic interactions. They could be hydrophobic interactions. They are hydrogen bonds, and they are van der Waals forces. And I would not go into the chemistry for that. Those of you who've done that, you pretty much know what a non-covalent binding is and why our body is going to go into the non-covalent binding. The other important thing is that sometimes what happens is there could be cross-reactivity. That's another thing, cross-reactivity. So there is a very big structure of an antigen we call macromolecule. It has different epitopes. But the thing is this, that what they do is that they change the antigen. They change the immunogenicity without changing an antigen. So this means that if you switch around some of the stuff, by itself they are not immunogenic, but if you switch around those molecules, they will become immunogenic. The classical case, it is the toxide, not toxic, but immunogenic. And remember that if something is not immunogenic, there is no point giving it to you as vaccination. Because by vaccination, we want to stimulate your immune system and want your immune system to prepare antibody. Right? So that's the whole idea. So by definition, when we say immune reaction, what we are saying is that 2 molecules have something to come and share. So they have to see each other, like antigen, antibody. They come across and they physically share in terms of non-covalent binding. And that many a time happens in different, I think I'll explain that when you come for the lab as well. That's why we have a reaction. We have A blood group versus B blood group. So there has to be some kind of a cross-reactivity that may happen, and they cause problems. Because when you use these terms heterologous or homologous, we basically are talking about the sequence of amino acid. So depending upon the sequence of amino acid, when they come together, they will see and interact with each other, and sometimes they give a reaction that basically is not something that we want you to do. And I'll just stop on this table. I want you to pay attention to the adjuvants that you probably will use in your labs, right? And it's very important for especially the dosage form for pharmacy. that we add substances to already existing immunogen to enhance immune response. So what I would want you to do is that I want you to look at this chart in your book and see, and again, I'm not going to test you about the composition. I will ask Dr. Doe to do that. But the drugs and vaccines, when we add the adjuvant, I want you to know when we add these adjuvants to these drugs, what is the mechanism of action that ensues? Many a time, the mechanism of action will be, it will either enhance uptake of antigen by antigen present cell or induce some of the molecule to express some receptor. So that kind of initial activity where your antigen presenting cell, because we want to kickstart, your immune system needs a kickstart. You are not responding to that particular antigen the way you should. And sometimes we have to push. So that kind of a push basically has to come from some of the common adjuvants that we add in some of the material to enhance immune response, to stimulate immune response, to push through so that your immune system sets in and makes antibodies, right? And then these antibodies basically are presumably life-saving things. Okay? All right, thank you.